A shortage of dentists in our area is just one of the many reasons Kansas City University chose Joplin as the place to build a new College of Dental Medicine. Thanks for joining us on Newsmakers. With us today is Dr. Linda Neeson and Dr. Aaron Kennedy from the KCU's College of Dental Medicine. Thanks for joining us, ladies. We really appreciate it. So why build a dental school here in Joplin? Dr. Neeson?
Well, Bobby, first of all, thank you for having us on. The College of Dental Medicine really started from the College of Osteopathic Medicine. The fact that Kansas City University was approached by the leaders of the city of Joplin to build a medical school here and actually was given the FEMA hospital to renovate, that started the idea of educating health professionals here in Joplin. And once Kansas City University built the medical school, they realized that there was a need for oral health and decided that they would build a dental school as well. And the city leader said, we will help you fundraise for that.
And in addition to that, Linda, dental schools are the safety net for many communities across the country. And so there are communities across Texas and California and North Carolina, and now Joplin, Missouri, that are building dental schools to increase access to care for community members.
And that matters a lot, having it available.
Absolutely. Absolutely.
And so we have a dental school here at Missouri Southern, and KCU and MSSU have worked together on other projects.
Yes.
Is there any collaboration between the two schools on this one?
Well, we believe that there will be. Yesterday, as a matter of fact, I visited the dental hygiene program and went to the clinic and met the director and the clinic director, and we talked about, the opportunities that we could do in terms of partnerships with the hygiene program as well as the dental program. So we anticipate that there will be many, many ways. The way Kansas City University currently participates with Missouri Southern is through what's called an articulation agreement for students, so that students who enroll here do their prerequisites after 3 years. They can enroll in the College of Osteopathic Medicine, and then at the end of the first year in medical school, they get the bachelor's degree from Missouri Southern. At the end of the 4 years, they will get their osteopathic medical degree. So we've extended that to include the College of Dental Medicine with both medical school and now the dental school. And then we also extended it with students who start at Crowder College. So students can start at Crowder, do a year, then come to Missouri Southern, do 2 years, finish their prereqs, and then start medical school or dental school. So we're really excited because we want to recruit students from this area.
Yeah.
And when we were able to recruit students starting in a community college setting, we can create a pipeline from how they're participating and learning in their community college all the way through dental school. And so these pipelines are a wonderful program that help recruit students and also give them a pathway to not only participate in a community college in their community, but also all the way through dental school.
It's the whole package.
Right.
Absolutely.
Right.
And we all know that there's a shortage of a lot of employees these days, especially in the medical profession. The year that everyone went through last year is just ridiculous. And I know a lot of dental offices had to close.
Yes.
But there's this thing called the health professional shortage area. And in Joplin, Missouri, I guess, we are one of those. Explain that and what that means.
So a dental health professional shortage area is a government term for an area that has less than the national average of either physicians or dentists. They have health professional shortage areas and dental health professional shortage areas. So within a 125-mile radius of Joplin, if you draw it on a map, all of the counties in that area are dental health professional shortage areas, which means they don't have enough dentists for the people to easily get dental care. It means that driving, you're going to have to drive further. You might not find a dentist to do a root canal where you live.
You also may have to wait in long lines if you're trying to receive emergency care, or even wait on a long wait list, maybe a few weeks or even a few months, depending on the area where you're in, to even have your first appointment.
Yeah, getting into any healthcare professional sometimes is difficult.
Absolutely.
Correct.
And in the nursing field, I know I've been told that the part of the reason for the shortage is the ability to teach nurses. Do you all see that in the dental profession?
Well, so far we've been fortunate that we haven't seen it, and I believe that a number of our teachers are already in the community, and are already in private practice, and they may be saying, well, you know, I'm thinking about retiring, but rather than retiring, I'd like to contribute in a different way.
Wow.
And I'd like to help educate the next generation of dentists. So I think we're going to be okay in identifying educators for the College of Dental Medicine.
And actually, we have had community members that were born in this region, have gone away for school, have even developed a practice or practiced in another city. And when they saw the news of Kansas City University College of Dental Medicine, we've received phone calls and emails, and they are so proud of their Midwestern heritage. They say, I'm ready to come back. I want to teach. I want to be in this community again. So not only are we recruiting faculty from the current community, but we are having people that want to come back to Joplin, Missouri and be a part of this adventure.
And we see that a lot, people coming back here, either to retire or just to work again.
Well, I think it speaks to the growing dynamic nature of Joplin. It really is a very dynamic community, and we're seeing, you know, as we see jobs move into the area, we see with the medical school, we saw a group of young professionals come to the area. So I think it really is a very exciting time in Joplin's history.
All we need now is a law school. I mean, we've covered in all the professions. So both of you have impressive resumes. Dr. Neeson, you've been all over the country, Harvard, Albuquerque, Fort Lauderdale, Dallas. Why Joplin?
Well, as I said, Joplin, it's a growing dynamic community, but what really caught my attention is that there aren't many opportunities to start a new school. And when you start a new school, you have the opportunity to develop innovative education methods, that you have the ability to look at the architecture and plan a school that will meet, you know, the needs, you know, the form follows function. So it's starting a new school is very different than going into a school that's already established. And I think KCU had the commitment, and the community was so open and welcoming that you just couldn't say no.
Right.
Yeah.
And is that the same for you, Dr. Kennedy? You were in Boston, Cambridge, graduated from Ohio State University, and Baltimore. Like, you came here.
Well, I couldn't say no to Joplin either. I actually grew up in a small town in southern Ohio, and I was from a small rural community, and my dad was a dentist in that community and my mom was a hygienist, and they had been involved in public health work throughout their entire career. And as their daughter, I was a part of that public health work too. Right. So when I was actually in a position before this, and I received a phone call, and I Googled Joplin, Missouri. I saw what was going on in the area, and I thought, this is my opportunity to give back to a community so similar to the one that gave a lot to me. And so I took the opportunity and I said yes, sight unseen, and it's been amazing to be here and be a part of Joplin. It's really a community that treats you like family.
Right.
And that's where I grew up, and I'm so thankful to be living in a community like that again.
Well, I'm glad that you're both here.
Her interview was scheduled March 25th, 2020.
Oh, wow.
And the school, I had started March 17th, and then Kansas City University went remote, and we sent, everybody was working remotely, so I had to cancel her interview, and she came anyhow.
That's awesome.
Isn't that amazing? That's an amazing story.
No doubt.
Yes. Yeah.
Well, we'll be right back and talk more with Dr. Neeson and Dr. Kennedy about why dental health is overall health, and it's not just about cosmetics.
Missouri Southern State University is roaring back this fall with in-person classes and a full slate of campus activities and athletic events. We're also recognizing your academic success with our new MOSO Merit Scholarships, offering first-time freshmen up to $5,000 per year. Discover what the world has to offer with the help of experienced faculty members who know you by name in hands-on learning environments. Our admissions and financial aid teams are here to help you get started. Learn more at mssu.edu/roaringback and be ready to roar with us this fall.
Welcome back. We're talking with Dr. Linda Neeson and Dr. Aaron Kennedy about the new KCU College of Dental Medicine coming soon to Joplin. So what we have touched on a little bit is about people's overall health and how physical health is tied directly to cosmetic or to dental health, and it's not cosmetic anymore. Talk about, how that's changing.
So basically, what people, I think what we never realized is that oral infection, that toothache that you have, leads to inflammation, causes inflammation. And that inflammation can affect your heart, it can affect your lungs, it can affect if you have diabetes. There is even new research that says that bacteria that cause gum disease are found in the brains of patients with Alzheimer's disease. So we're learning that the mouth is truly connected to the rest of the body, and bad oral health can cause chronic inflammation and worsen disease in other parts of your body.
And so what's so important about that is if you do have that toothache and you're thinking, it's really challenging to get to a dentist, it's a long drive, I've been waiting in a few, longer wait lists or in a line, it's really important to prioritize and stay persistent with identifying a dental home, because if you continue to allow that toothache and think that maybe it's only affecting your oral health, you might not realize that it's affecting your overall health as well. And so staying persistent and finding a way to receive oral health care or dental care is really important.
And I always like to tell patients that prevention is, it takes a little more time, but it's worth it. It's like putting oil in your car. Right. You wouldn't, like, preventive maintenance on your car is the least expensive approach to keeping your car running. Right. And it's the same thing, going, and if you have dental insurance, use it. Dental insurance isn't insurance per se, it's prepayment. It helps you pay for that exam. It helps you pay for the x-rays. It helps you pay for the cleaning. It might not pay all of it, but it might pay about half, and that helps people get dental care.
Well, and a lot of times kids are, parents won't know that their kids have problems until they complain about an issue, rather than going every 6 months. I guess same with adults.
Right.
And when I was growing up, we only went to the dentist, when we needed to, not because we should, for, like you said, preventive maintenance. And a lot of people will just sacrifice a tooth as opposed to fixing that tooth because of the cost.
Oh, absolutely. I mean, it's hard. If you need a filling's probably the least expensive treatment. But if you don't, dental disease is different than medical disease. You get a cold, you get a flu, and in 7 to 10 days it goes away.
Right.
A tooth decay doesn't. Tooth decay continues to get worse, and it continues to get bigger until all of a sudden it's in the nerve of the tooth. Right. That's when you feel the pain. Right. That's when you have the swelling. And now, instead of a filling, you need a root canal. Yeah. And that could be $1,000. Right. So that's an expensive treatment versus maybe the $200 filling that you had, 6 months to a year ago, but didn't do anything. And for many people, they'll say, $1,000 or $100 to have it extracted, I'll sacrifice the tooth.
Right.
And that, you want to try not to do that.
Sure.
And
there are so many outside factors, not just what you eat, but your water. And I know a long, long time ago, Joplin put fluoride in their water, and there's a big controversy about that. But fluoride helps.
Fluoride is nature. Fluoride, it's like the two of us are like, fluoride is nature's cavity fighter. Right. The ocean is fluoridated water. Sharks have fluoridated teeth. So, think of fluoride is in the Earth's crust. It's a mineral that's found 16% in the Earth's crust. I almost had a fluoride rock that I almost brought, to show you this is what fluoride looks like. So, people are worried about fluoride when they really shouldn't be. Fluoride has been shown time and time again to have significant oral health dental benefits.
And in addition, you mentioned earlier that parents might have a hard time finding a dentist for their children. Well, there's wonderful programs in Joplin, similar, called the Score One program, and these programs go into schools and they provide screenings and exams, preventive treatments, like a professional application of fluoride, like we just talked about, and they actually help students learn about how to keep their mouth healthy and to have a really wonderful smile. And so that's always something that I think of when I think of children having a hard time accessing care. You might want to look into your school system, because there's wonderful programs out there that are available for students and will help them have fluoride not only in the water that they're drinking at home, but then have it professionally applied while they're at school so that they can continue to become healthier.
Yeah, and one thing that I know that our campus does is they give free or low cost exams for the kids who are learning.
Yes.
Will your school do that as well?
We will. Our fee structure will be lower than private, that you see in private practice. And the reason for that is when you come to a dental school, it will take longer. The dental students are doing the work, so it's a trade-off of time versus money.
Correct.
They will take much longer, to do the filling, to do the cleaning. It will be of excellent quality because there will be faculty all over the place.
And dentists who are now.
Yeah, the dentist faculty who won't let them out of the building until the filling is perfect. But it's the other thing about working with, partnering with Score One for health or the dental hygiene program to work with young children, whether they're preschool or elementary school, is that's the first time we're recruiting for dental school.
Right.
So, the other, our other hidden agenda, in addition to providing good preventive oral health, is that they see what dentists look like, what dental hygienists look like, and you get them thinking, have you ever thought about, a career in dentistry?
Right.
It's never too soon.
We do that with kids who tour the TV station.
Yeah, exactly.
Put them on camera and they're just like,
Well, that's way cooler than, seeing the dentist, I have to tell you.
I don't know if it compares.
Yeah, I think they have a coolness factor we don't have.
And another big thing, along with the cost, a lot of parents are on Medicaid.
Yes.
And not
yes.
a lot of dentists take Medicaid.
Yes.
Well, the College of Dental Medicine will accept Medicaid just for that reason, because we realize that many of the private practitioners are unable to accept Medicaid because of the reimbursement levels.
Right.
The reimbursement levels are fairly low. Our fee
Really
structure.
low. They are really low.
Our fee structure will be, similar to the Medicaid fee structure. So we will accept Medicaid because we realize that maybe 1 out of every 4 individuals who are eligible for Medicaid get the care to which they're entitled. So we want to help that aspect of access to care.
And you said insurance companies are changing the way that they look at dental care.
There's been a number of studies that have looked at, and these are insurance companies that provide medical insurance and dental insurance, and they did studies that said, okay, we're going to look at our diabetic patients, and we're going to provide 2 visits or 4 visits a year. We're going to provide scaling and root planing, or what's called a deep scaling. And then we're going to look at the cost of their medical care. And what they found is that the medical care cost of the diabetic patient went down, was lower when they provided the dental care. So these insurance companies are now providing dental benefits as part of their health insurance because it's saving them money on the health insurance. So there's, so we think that, that would happen. So right now, if you're over 65 and you have Medicare, you've just lost your dental benefit. If you're working for a company, you have Blue Cross Blue Shield, you have a medical benefit, a dental benefit, you retire, you switch to Medicare, you've just lost your dental benefit. So, we're seeing, people talking about, gee, should we add a dental benefit, a vision benefit, a hearing aid benefit? Because that's what people as they get older need.
Well, and in addition to adding a benefit, these same companies have actually looked at patients that have chronic disease, for example, with diabetes, and they found that they can increase the amount of preventive services that they're providing, whether it's more frequently or additional preventive services, and that can help manage their chronic disease. What we found with diabetes is that when you have the deep cleaning that Linda just mentioned, or you have regular cleanings after that to maintain, it actually helps you control your blood sugar and keep your diabetes under control.
Which is it controls everything.
It controls everything. And so it's this research that the insurance companies have been providing the public, and the decisions that they've been making have actually been making all of us healthier. Because they're identifying what preventive services we all need to not only achieve wellness, overall wellness, but then how can we stay there too?
And it isn't cosmetic anymore. I mean,
Oh, no.
It never was cosmetic, but that's the way they looked at it. It's just it just looks good.
Yeah, and it's not cosmetic, it's inflammation. Think inflammation.
Right.
Everything we do in terms of wellness.
Your gut, your
That's
heart,
right. That's
everything.
exact is trying to decrease inflammation so that your overall health system is healthier. Yeah.
And how did the pandemic affect your, I guess, discipline when it comes to that?
So the pandemic, in my career, I have never seen dental offices close.
Right.
To see dental offices close was unbelievable. And then when they opened, what was remarkable is that they basically modified the infection control procedures, had HEPA filters where they needed to, had their staff with masks. And the rates of infection among the dental professionals was low. So we figured out as a profession how to open safely so that patients could come back, and how to keep patients safe as well as the dental team. But it was remarkable in the sense that that's never happened in my career, that we've closed offices. And then we saw, because people were wearing masks, we saw mask breath. We saw people grinding.
Yeah.
We saw a whole new array of dental conditions, right?
Well, in addition to all of the conditions, overnight, when those offices closed, dentists wanted to continue providing care for their patients in their community. And so my office and my team, we were serving frontline healthcare workers, including EMS, some of the police officers, nurses. And so what we did is we actually offered teledental services. So one day we closed and we were working on our infection control procedures, preparing to reopen. And that exact same time, we adopted new technology to provide teledentistry, innovative ways to provide care. We would even be able to send products to patients that needed it, triage patients for emergency care. So I think what's remarkable about this story is not only did these offices close and reopen safely and keep patients safe and community safe, but in the midst of all that change, they were saying, I want to do something new.
Right.
And I'm going to take on teledentistry, and I'm going to do that really well. And so what we've seen is teledentistry has hung around. Many offices are continuing to implement teledentistry, whether it's meeting a patient for the first time or helping triage in their office or doing a follow-up.
And so I never would have thought that was possible.
Me either.
Yeah. So at what point will students from KCU Dental School, at what point will they be able to give back or make a difference in the community?
Immediately.
Okay.
That's the answer. So starting in their first year, they're going to be working with community-based programs like the Score One program I mentioned earlier. And as they progress through the curriculum, they're going to be serving the community in that capacity. And then they'll be practicing in their third year in the Oral Health Center. And then during their fourth year, they're going to be doing multi-week rotations at community health centers all across the 4-state region. Wow. So from the time they enter dental school till the time they graduate, they're going to have various opportunities to serve their community.
And how long, the program's 4 years total?
Yes.
Okay. And are the dental students, you think they'll remain in the area once they graduate?
We hope some of them do. We hope some of them do. We're certainly recruiting students in this area. And then we're looking to recruit students who grew up in small towns, who aren't afraid of a small town, to become students here, and then maybe they'll go back to small towns in other states. But we're hoping, our first class, we're looking for 80 leaders who will be pioneers, who aren't afraid to be first, and because we want them to be community leaders as well. Look at the dentists in the community here. Many of them are on school boards. They, can be in city government. That's the kind of leadership role you're going to be asked to play if you're a dentist in a small town.
And are there incentives that dental students will or can get? Are there programs to keep them in the small towns, like reimbursement programs for student loans? Or
some communities do. There's loan. You know about loan, loan repayment. Yeah,
there's multiple loan repayment programs, and oftentimes you can receive those either if you're working in a rural area or within a certain type of setting. For example, a federally qualified community health center. And what I've learned from my own story is that I trained in community health centers, and as soon as I graduated, because I was comfortable in that setting, because I felt like I had experience and competence in that setting, I was looking for similar career paths and similar opportunities. And so what we've learned from our partner dental schools is that when students are trained in a variety of communities, when they graduate from dental school, they often look for a variety of career opportunities, and they're willing to, let's say, participate or serve in a community health center because they feel confident and they've had experience there. So
They're not afraid. They're not afraid of it.
Not afraid.
Yeah.
Kind of a pay it forward
Absolutely.
scenario. And when will the school open?
The school will open in August 2023. Our initial timeline was August 2022, but the pandemic has postponed it a year, primarily because the accreditation process basically closed. They closed the accreditation process to new applications because prior to this time, you had to submit your application on paper. And the Commission on Dental Accreditation went remote. There was no one in the office to accept the paper.
Sure.
They said we've got to set up a web-based portal. So they didn't set that up until February, and we were the first ones that applied once they set up the web-based portal. So it basically put us behind a year. So
Well, I mean, everybody expects delays, especially this time, because of that.
Yeah.
And what do you look forward to upon opening?
Well, there's a lot of things to look forward to. It's like
big question.
we have this wonderful wish list. We're looking forward to hiring incredibly talented, committed faculty. We're looking forward to recruiting talented students who, as I said, aren't afraid to be pioneers and leaders. We're looking forward to a beautiful new building, this beautiful $80 million building that we broke ground on 2 weeks ago, that will be state of the science, that will have new technology. What else? We're looking forward. We have a lot of things.
Yeah.
We're looking forward to partnering with our medical colleagues at the College of Osteopathic Medicine and our Doctor of Psychology faculty.
I have a long list of items that I will be celebrating. I can tell you that now. But one of the, what I look forward to most is the impact that this experience will have on student lives. When students have a wonderful educational experience, they're changed forever. I think we can all look back on our lives and think, when I had this experience or when I was impacted by this instructor or teacher, my life was changed. The entire trajectory, I went from going this way to this way.
Right.
And I know that that's the impact that we'll be able to have not only on our students, but in the community. And to see those stories unfold is something I really look forward to, because we're going to see lives changed, whether it's patients or students or even faculty. And you just can't celebrate life change enough. So,
Well, I know the Joplin community will really benefit from this school opening, and the students and the kids as well. So we really appreciate you all being here with us today.
Thank you.
thank you.
Thank you. I want to thank Dr. Linda Neeson and Dr. Erin Kennedy from the new KCU College of Dental Medicine for joining us. This is Newsmakers on KGCS TV from the Ruth Copeland Studios here at Missouri Southern State University, and I'm Bobby Potroff. We'll see you again soon.